Hello everyone, welcome to this lecture. This is going to be our first lecture. I'm Delvin Adero and I'll be taking you through the course Foundations of Nursing 3, which is basically basic life support. I encourage you to configure your e-learning platform such that you may keep up to date with the assignments, quizzes, and any discussions that are posted and any activity that will be posted on the e-learning platform. Now, this week we're going to look at topic 1, which is basically the introduction to Foundations of Nursing 3. Before then, I want us to go back to the book of Ezekiel 37:1-14. I will not get all, but just a sample of it, which says, "The hand of the Lord was upon me, and he brought me out of the spirit of the Lord, and set me down in the middle of the valley. It was full of bones, and he led me around among them. And behold, there were very many on the surface of the valley, and behold, they were very dry. And he said to me, Son of man, can these bones live? And I answered, O Lord God, you know. Then he said to me, Prophesy over these bones, and say to them, O dry bones, hear the word of the Lord. Thus says the Lord to these bones, Behold, I will cause breath to enter you, and you shall live." So basically, it's about the story of the dry bones that were reconnected, and the breath of life gave them life again. Now, this I shared just in case you find yourself in a scenario where you really need to attend to many people who all may need emergency care, and you feel worn out. Sometimes you're not sure what is going to happen. Remember this verse and believe that you will do that which you can do, but the God will work with you, and through your hands, your patients will receive healing. Now, back to our topic, which is the introduction. By the end of this lesson, you as a student is expected to explain the general aspects of basic life support and to describe the assessment of accident situation and medical emergencies. Now, basically, when we now go back to the general concept of basic life support, just from the definition, we know that basic life support refers to the care a healthcare provider or a public safety professional provides to patients who are experiencing respiratory arrest, cardiac arrest, or airway obstruction. So basically, basic life support may not really be particular to the healthcare providers alone. Anybody at the scene where basic life support is needed may be instructed over the phone, or if they have skills of basic life support, can assist the victim as they wait for advanced care. They can assist the victim to prolong their stay alive, or to improve their outcome of the situation. Now, as we go through the basic life support, I want us to remember the heart and the heart diseases. Remember, the heart is a very vital organ to the human. Now, when you look at the heart, the major function of the heart is to pump blood. One, it pumps blood to various parts of the body, oxygenated blood, to take oxygen and nutrients to various cells at different parts of the body. And another function is to pump the blood to the lungs, where the blood will be oxygenated. So generally, the heart is a very vital organ. In a case where there is a heart disease, then this can be altered. There might not be adequate oxygenation due to the maybe improper pumping of the blood to the lungs, or there might not be adequate supply of oxygen and nutrients to the cells, to different parts of the body, due to a heart disease. And when that happens, even other vital organs like the brain will lack adequate oxygenation and nutrients and may eventually die. Now, usually in an accident situation, the heart can maintain the, the brain can maintain its health without so much damage for around 4 minutes. But what happens in an emergency situation or in an accident situation, before the rescue team arrives, you find that it takes a longer period of time. In developed countries, it may take even 6 to 8 minutes, but in third world countries or underdeveloped or middle class countries, it may take a longer period of time. Sometimes it can even take 20, 30 minutes or even 2 hours for the arrival of the rescue team. So during that process, what happens? We know that the major cause of death generally in adults is the heart disease. And let me say problems with the heart. And you find that this, therefore, makes our basic life support focus mainly on the heart, though it's not on the heart alone, but the heart is our main focus. So by the time that you are at the scene and you're waiting for the rescue team to arrive, then you need to take care of the heart even as you wait. Now, how do you do this? This is by compressions and etc. We'll look at that in our later part of this lesson. And something else that you must also look into is chain of survival. When we talk about chain of survival, we are basically trying to look at which approach to take in order to be able to maintain the life or to sustain the life of this person even as we wait for the rescue team. Now, generally, the chain of survival provides the person the best chance to receive the care needed and return to the healthy life. And we find that research has been done over time, and research continues to improve how we should respond to life-saving techniques to emergencies. And therefore, these techniques that have come up because of research, they are basically organized in a systematic response. Now, that organization of systematic response is basically what we call chain of survival. And what is at the topmost priority of chain of survival is basic life support. Now, the actions that make up basic life support, generally, as we have said before, try to prevent or slow the damage until the cause of the problem can be corrected. Now, usually, being that basic life support is at the top of the chain, it means it is very vital for the survival of a person. And it improves the chance of surviving until advanced care becomes available. So even as you wait for the the emergency rescue team, the basic life support should be continuing. We have various chains of survival. We have the adult chain of survival, and we have the pediatric chain of survival. Now, when we are talking about adult chain of survival, as you can see in the figure, first you recognize the symptoms, and then you call the emergency team, the emergency response or emergency medical services. After that, you perform CPR. Now, CPR is very vital in basic life support. It is what will help us delay the worsening of the situation, and even as we wait for the rescue team. And apart from that, the early CPR, when done appropriately, it kind of prevents early complications out of the situation of the victim, or it helps to prolong the stability of the victim, even as we wait for the emergency response or the advanced life support. Now, when after performing the CPR and maybe the emergency response team have arrived, then the defibrillation can be done. And that goes, as much as defibrillation is done, later the person, it depends with whether they improve or not, they can undergo advanced life support and thereafter post-cardiac arrest care. Now, we also have a chain of survival in pediatrics. So generally, we must know and acknowledge that emergencies in children and infants are not usually caused by the heart attack. Heart attack basically is a common cause of emergency situation in adults, but for children and infants, most of the time it is as a result of problems with breathing, that may trigger cardiac arrest. So the most important step of the pediatric chain of survival is to prevent the cardiac arrest. Now, the first thing that you must do is to prevent the cardiac arrest. And secondly, after preventing that, you perform the CPR. Then you call the emergency medical services, when they come or when the patient reaches the hospital, then advanced life support can be offered, and post-cardiac arrest care can also be offered. Now, the basic thing that I want you to remember is to be able to differentiate what really causes most of emergencies in adults and that in children. Just like we have said, in adults it's mostly heart attack. In children, the main problem is the problem with breathing, which eventually may develop cardiac arrest. So the main focus is the breathing. Now, we have guidelines on performing basic life support. Now, these guidelines are general. However, in every situation, there are specific procedures to go about every emergency depending on the cause. Now, the basic guidelines include the rate, the depth, the technique, the sequence, the ratio, and what we call the community. Now, when we talk about the rate, basically, in before 2010, the rate that was recommended used to be 100 compressions per minute, but after 2015, after 2015, the rates have been improved to be between 100 to 120 compressions per minute. Now, another area of concern is the depth. How deep should the compressions be? Usually, it is supposed to be 2 to 2.5 inches or 5 to 6 centimeters in adults. Now, we try so much that as much as we need the compressions and we need them adequately, too much exertion of pressure can cause injuries like breakage of the ribs. So the depth of 2 to 2.4 inches is just adequate. Now, the technique that is used, what is the right technique to be used? Remember, the technique that is used will determine whether the compressions or the CPR that is being done is sufficient or is adequate enough to maintain. When the quality of compression is good, then the outcome of the victim is equally good. Now, in real life resuscitations, we will discover, or you will discover at times that usually the resuscitations are the compressions may be too slow or too shallow, and sometimes or most often they are interrupted with what happens around. But remember, it needs to be continuous. The depth needs to be just right, and the compressions are supposed to be between 100 to 120 compressions per minute. Now, this skill is not a skill that someone may know in a day, but with practice, then the person or you as a healthcare provider gets better with the skill and the knowledge, even as you compare with outcome in each time that you get involved in such. Now we have the sequence. Initially, before 2010, it used to be airway, breathing, and circulation. But the sequence was changed in around 2015. The sequence was changed because there was a realization that the compressions were doing wonders, especially when they were done rightly. They were doing rightly and promptly to mean as soon as possible. Now, that made the change from airway, breathing, and compressions to compression, airway, and breathing. Now, the ratio generally, it is still recommended that the cycle, if we have 30 chest compressions, there should be 2 rescue breaths. That is if the rescuer is 1. If we have 2 rescuers, then we have the ratio of 15 to 2, 15 compressions, 2 breaths. Now, when we talk of community, basically what we mean is that generally there could be bystanders, and these bystanders can as well participate in helping the life of the person who is the victim. Now, what happens is that the bystanders can help in things like even using the phone to reach the emergency response team. If there's nobody who knows what to do, they will give the information as per what they have assessed, and through maybe putting on a loudspeaker and contacting the response team, they can be guided on a loudspeaker on what to do, even as they wait for they can be guided or instructed by the emergency medical services on what to do, even as they wait for the rescue team. Now, we have assessment of accident situation and medical emergencies. Now, in this, I want us to focus on environmental assessment and response assessment. Now, when we say environmental assessment and response assessment, this basically revolves around the area or the scene and even when the emergency team gets to respond to the emergency situation. So basically, we find that it is important for the person at the scene, that is the bystanders, the rescuers, the people who are at the scene. It is important for them to know the steps of basic life support. Now, the first step is the step of the assessment that we are talking about. Now, in environmental assessment, we are basically just going to look at the rescuer is expected to look at the safety, the environmental safety. Is it safe? Is the environment safe for him to assist in rescuing? Is the environment safe for the patient? So the focus is the safety to self and safety to the patient. Now, again, you go to assess and see if it is important or if it is safe to move the victim. On a rough assessment, you'd see the victim and the kind of trauma the victim is in. So you should be able to identify if it is safe to move the victim. Now, most of the time, accident victims are not supposed to be just moved like that. It can only happen when it is absolutely necessary for the victim to be removed, because sometimes movement may cause more injuries, especially to the spinal cord. Now, again, there is assessment of the patient. What is the response of the patient or the victims? Let me call them the victims. What is the response of the victim? Apart from the danger that may be to the victim, what is the response of the victim? You're trying to find out the status of the victims that you have. Now, if you are at the scene, you can tap the patient and shout, ask the patient, are you okay? Is the patient okay? Ask them, are you okay? Now, the client can either respond or not respond depending on their status. Now, if the client responds, then you can leave the client and call for help from the emergency medical services. And then you return as quick as possible to reassess the condition of the person. In a case where there are two rescuers now, one will begin after assessment, one will begin the CPR as the other one contacts the emergency medical services. And if a person is alone, when we have a lone rescuer, After assessing, if the patient is able to speak, you call the emergency medical services and then return to the victim to reassess and then to perform the CPR, which will be later followed by defibrillation. Now, activating the emergency medical service basically is just calling the emergency medical service. Over that, they can give step-by-step management of the patient or the client to people on the ground, such that any complications may be delayed until they arrive. Now, that would mark the end of our introduction. Now, these are some of the resources that we have. You can access them. And if you're not able to access any textbook, you can also refer to the textbooks that are quoted in your course outline. If you're not able to get any, you can contact me so that I avail any ebook for you that will guide you in your studies. Now, make sure that you participate in everything that is required for this week in time. Thank you.